Good afternoon. I would like to thank the Psychiatric Federation for inviting me today, the observation of the International Day of Yoga, to talk about integration of yoga into clinical practice. I'd like to thank particularly Professor Gandaha, Madam Rajashree, Professor Sihan Williams, and Dr. Sajibana Amarsinga for arranging this. My topic today will be yoga and mental disorders, and I am talking about yoga in general, not particularly restricting it to any particular belief system or religion or culture, in the wider sense of science of the mind. And mental disorders, uh, I am looking at more the minor mental health disorders, and I'm a little bit cautious about using it in the major mental health disorders, although we have had a text already. Uh, my experience has been that it may sometimes cause uh, precipitation of symptoms, untoward reactions, particularly in prodromal phases of psychosis, acute schizophrenia, mania, and so on. So anyway, I will restrict myself to minor mental health disorders, and particularly I conditions. Yeah, anxiety is very prominent. General anxiety disorder, phobias, panic disorders. Also, where anxiety or hyperarousal is found, like in PTSD, stress conditions, and obsessive compulsive disorder, where there may be underlying anxiety. Various minor depressive conditions, which were earlier called neurotic or reactive depression, whereas I will be a little cautious about psychotic depression. Somatoform disorders, uh, which earlier terminology you had conversion hysteria, functional disorders, hypochondriasis, neurasthenia, psychogenic pain, hyperventilation, IBS, cultural bound syndromes like in South Asia, uh, Dutch syndrome, and various idioms of distress. And also the whole field of psychosomatic medicine and diseases, the ones that involve conditions like bronchial asthma, hypertension, eczema, various gastric refluxes, and so on, where stress may play a role, gastritis, um, autoimmune diseases, various arthritic conditions, and even conditions in cancer, where calming and relaxation methods may be useful, which have a basis not only in yoga but in even other physiological mechanisms. The whole pathophysiology and the rationale for using these kind of techniques, particularly the ones that produce relaxation, is to counter the effect of stress, which can cause a vicious cycle, where the stress causes tension in muscles that causes pain and headache and feeling of tightness, apprehension, and that pain and that apprehension further increases the stress. You get a kind of vicious cycle. So the calming and can break the cycle. And if you look at more in detail about the various um, uh, pathophysiology, the sympathetic part of the nervous system and the hypothalamic pituitary adrenal axis may be stimulated, and the famous general adaptation syndrome. Yeah, you might get exhaustion under chronic stress or extreme stress. I won't go into detail about these things. You may be quite familiar with this. Just to mention the various kind of conditions that affect the various organs, uh, various cardiac conditions, respiratory conditions, conditions involving the bowels and the bladder, the musculoskeletal system, and so on. Where these techniques can be used in addition to other methods, pharmacological methods. So when we talk about the management of minor mental health disorders, generally Western biomedicine recommends psychotherapeutic techniques including CBT, which have been shown to be quite effective. But doctors, probably because they are in a very rush, and the expectations of patients also, and psychiatrists included, tend to use various psychotropic medications including antidepressants, anxiolytics, hypnotics, and even antipsychotics like quetiapine and so on. But despite the claims that have been put forward by various pharmaceutical companies, there's not much evidence for showing effectiveness. Not much superior to placebo. Definitely there is some effect, and there may be some short-term gain, but in the long term, the side effects and dependence and so on can cause adverse reactions to the patient. So generally when we look at treatment of these kind of conditions, minor mental health disorders, particularly the anxiety, the ones that are producing tension and uh, tension in the muscles, ones that have been favored was first introduced by Jacobson so long ago in 1930s, 38, called progressive muscular relaxation, where you relax the muscles starting from the toes and building your way up one by one till the whole body is relaxed, and this is supposed to uh, inhibit or cause a kind of relaxation of all the muscles. Benson described something called the relaxation response, where repetition of certain words again and again can lead to reduction in pulse, blood pressure, breathing, and muscular relaxation. Most of these methods also incorporate certain breathing exercises where the breathing is brought under conscious control to have a much more slower, deeper, regular breathing using the diaphragm to counteract the kind of rapid, shallow breathing you find in emotionally disturbed persons, particularly the ones where you get kind of a hyperventilation. But similar methods have been used in various cultural systems, particularly yoga, for centuries. So I would like to uh, talk about these practices in contrast to the ones that are used in Western biomedicine. Using cultural traditional methods have various advantages. They are based on the cultural belief systems. They are less stigmatizing. They are more acceptable. They have associations with positive childhood experiences, and they are very cheap and easy to do. Uh, Cost effective with minimal side effects, and can be used into prevention, as promotion of well-being, and therapeutic ways, which I will now talk about, and can be done at various levels, individually with patients, but also in a group setting with a family or in the community, which is very time saving and also saves labor. So what are these techniques that I would like to talk about? Um, One is the repetition of words, which I have found to be very effective and very easy to use, and it's found in almost all the cultural religious systems. The Hindus call it japa, and it usually entails repetition of a phrase or a group of words. Uh, So the most popular one is Pranava Mantram, or Om, Om, uh, again and again. The Buddhists have pirit or chanting like Buddhang Saranang Gacchami. The Islamic practice of dhikr, or sometimes pronounced as dhikr. They use a tasbih and remembrance of Allah. There are various phrases. Subhanallah is a popular one. The Catholics have the rosaries or the prayer beads, and they repeat Hail Mary or some other Jesus prayer. Cambodians have a system called Keta, where they repeat a word like Putu, and the Vietnam they have something called Mofit. And the scientific method that uses some words or repetition of words called transcendental meditation, again based on some earlier yogic techniques. They usually entail a breathing exercise, sometimes called pranayama in the Hindu tradition, anapanasati in the Buddhist tradition, or mindful breathing. Muscular relaxation, just like the progressive muscular relaxation of Jacobson, is Shanti Asana or Savasana. And the Buddhists have the mindful body awareness, and some techniques like Tai Chi also produces a relaxed, calming body. Meditation techniques, which I will not go into too much today, and also some massage techniques can produce calm. So, a regular repetition of words, which I have already mentioned, in the different traditions, using usually a kind of a necklace, tasbih, rosaries, or Hindu mala. Then the deep breathing that teaches a slow, controlled, diaphragmatic type of breathing, sometimes called Anapanasati in the Buddhist technique, and pranayama. Then the muscular relaxation techniques, Chanti Asana or Savasana, which you relax groups of from starting from the toes right up to the up the body till the whole body is relaxed, and you get a feeling of calmness and relaxation. And the meditation techniques, dhyanam, samadhi, vipassana, contemplation. So benefits of traditional methods can be at different levels, physical, and there has been a lot of research by different people, and in certain conditions like asthma and hypertension and so on. Mental, this is what we are talking about today in anxiety and depression. Social, there have been research that have shown there's a better social cohesion and improvement in, even though it may not be widely practiced, even if 1% of the population starts practicing, they have shown that crime rates and violence and so on may be reduced. And of course, the spiritual benefits, which are the actual ultimate aim of some of these practices. So I will just mention very quickly some studies that have shown. One study that was done by Katani and al. showed that when they compared CBT to meditation relaxation, the results were almost very similar, the benefits. And we have done some studies in Jaffna, Jaffna Hospital and Telepilla Base Hospital, and over the years we have used it in various conditions, like which I will mention later on. I have used it in Cambodia, in Udong, Battambang and other district hospitals in 1996 to 97 when we had a community mental health program under the Transcultural Psychosocial Organization. It's all documented and published. So quickly, we have used it in Jaffna, usually in relation to other practice. So sometimes it's with counseling, or sometimes we used drugs also, but sometimes it's stand alone in Jaffna. In Cambodia, usually it was in addition to other practices because of the expectations of patients also. And outcome, we found that there was a high dropout rate because many of the patients who come to a psychiatric clinic are expecting drugs and they can't be bothered doing these practices. But still, for all that, um there was some improvement, and in Cambodia, 70% improved, and no deaths at all. And we have also done it in various community settings, in Jaffna, in schools, and in the community, and Cambodia also. We taught it to various core groups that were functioning in the village. So the results of study that we did in the Adelaide of South Australia, which again was a good opportunity because people came from various countries, particularly from Islamic countries, the Middle East, and more recently, of course, Afghanistan and also Syria, and even countries like Burma and so on. So I am also running out of time. I'll just quickly so these are the countries of origin. All these refugees come from a wide background. Um, so these are the various places that they have come, all the hotspots in the world. And this is the various ethnic groups. So a lot of Islamic majority are Islamic, so I was able to use this dhikr and it was well received, and particularly there was I could see some benefit, although very often we use drugs and other psychosocial support systems, but we used it in other religions also, other cultural and ethnic groups. Okay, so I'll just these are the background etiology. Very often some kind of torture, and that is the program was for people who have been undergone torture, refugees, and these are the various. So majority had PTSD or depression. These findings can be found in the where we have reported it in the International Journal of Mental Health Culture. So these are the relaxation techniques that we used. So 28% improved. Okay, thank you very much. Sorry, I went over time a little, but we have a question time, and I'm happy to answer any questions that you may have. Uh, Thank you.